Okay, so we're going to be performing the first medication check. This is to check for accuracy and completeness on the medication administration record compared to the prescriber's order, and then we're going to pull the medication out while we're doing so. So for the patient Jane Doe, our first medication is regular insulin, and the dose is per the sliding scale, and since she has a blood glucose level of 260, we are going to be providing 3 units of insulin. The time is before her meal, so before breakfast, and the documentation is correct on the medication label or the prescriber's orders and the medication administration record. And the route is subcutaneous, and the expiration date is October 2021. Next, we have for patient Jane Doe, we have the medication lisinopril with a dose of 10 milligrams. The frequency is daily. The documentation is correct on the MAR and the prescriber's order, and the route is by mouth. The expiration date for lisinopril is October 2021. And lastly, we have acetaminophen for the patient Jane Doe. Again, the medication is acetaminophen. The dose is 650 milligrams. The frequency is every 6 hours as needed for the patient's pain of 1 to 3. And the route is by mouth, with the documentation is correct with the MAR and the prescribed order. The expiration date for acetaminophen is October of 2021. All right, and next we're going to do the second medication check, and here we're going to be preparing the medication and then also compare the medication label to the MAR. So we have for Jane Doe, the patient Jane Doe, we have the medication regular insulin with a dose of 3 units per the sliding scale for 260 blood glucose level. The frequency is before meals, and this is before breakfast. The right documentation, so it is correct on the medication label and the MAR. The route is subcutaneous, and the expiration date again is October 2021. Next, we have for patient Jane Doe, the medication is lisinopril. The dose is 10 milligrams. The frequency is daily. The documentation is correct on the MAR and the medication label, and the route is by mouth with an expiration date of October 2021. Lastly, we have for Jane Doe, the medication is acetaminophen. The dose is 650 milligrams. The frequency is every 6 hours as needed for pain 1 to 3. And the documentation is correct on the MAR and the medication label. The route is by mouth, and the expiration date is October 2021. Alright, so now we're going to go ahead and go into the patient's room, and we're going to educate them on their medication as well as administer the medication. Knock knock. Hi, my name is Cassandra. I'm going to be your nurse today. We're going to go ahead and talk about your medication as well as administer the medication. So I'm going to go ahead and close the door for the patient's privacy and wash my hands for 20 seconds and put on some gloves and perform an environment check. Okay, looks like the oxygen is working properly, the suction is functioning properly, the bed rails are up, the bed brakes are on, and I'm going to move the bed up to my waist level. Can we go ahead and verify your name and date of birth, please? Okay, thank you. And then can you verify any allergies that you may have? Okay, no allergies, perfect. So before we get started, I'm going to go ahead and assess the skin. I see no obstructions or no abnormalities in the skin that may prevent injection. Are you experiencing any pain or discomfort while swallowing? No? Okay. And then can you rate your pain on a scale of 0 to 10 for me, with 10 being the most excruciating pain? A 3? Okay, perfect. Thank you. So now we're going to go ahead and talk about each medication that you're going to be taking this morning. So you're going to be taking regular insulin, which is a medication that is injected to regulate blood glucose levels or blood sugar levels. And so first thing we do before we give you insulin is we take your blood glucose levels through a glucometer. Some of the side effects that you may experience from this medication are hypoglycemia, which is low blood sugar, dizziness or lightheadedness, shakiness, blurred vision, confusion, trouble concentrating, and then sometimes swelling in the arms and legs. Now, what questions do you have for insulin? None? Okay, moving on to lisinopril. Lisinopril is an antihypertensive medication that you take by mouth every day. Now, this medication it helps you regulate your blood pressure, and so that being said, before you take this medication, it's important that we take your blood pressure first to make sure that if your blood pressure is actually low, we don't want to lower it even more. Um, and some of the side effects that you may experience from this medication are dizziness, confusion, fatigue, headache, irritability, and sometimes memory impairment. Now, um, some of the other things that we monitor for this medication is your kidney function. And so we'll take your serum potassium levels, blood urea nitrogen levels, and creatinine. And what questions do you have on this medication? None? Okay. So let's go ahead and move on to acetaminophen. Acetaminophen is a pain medication, another one that you take by mouth as needed for your pain. And for this, it's important that we monitor your blood levels for your liver function. So we look for things such as AST, ALT, bilirubin, creatinine levels, and then we also pay attention to the color of your urine to make sure that your kidneys also functioning properly. Because we don't want you to have toxicity as a response to this medication. So some of the side effects that you may experience from this medication are fatigue, hypotension, so lowered blood pressure, constipation, or nausea. And what questions do you have on acetaminophen? All right, so before we administer the medication, let's go ahead and can you verify your name and date of birth for me again, please? Okay, perfect, thank you. And then what allergies do you have? None? And then can you verify your pain level again for me? 3? Okay, thank you. So now we're going to be performing med check 3 for each of the medication. Um, for patient Jane Doe, she has regular insulin. The dose is 3 units that I'm going to um, get with a 25 gauge needle with a 1/2 inch in length. And it will be injected subcutaneously at the back of the arm. And after I've administered the medication, I will dispose of it properly in the correct biohazard sharp object disposal box. Um, and then next we have lisinopril. Okay, the patient's blood pressure appears to be normal, and so we administer the lisinopril by mouth with a glass of water. And so we have the right patient, which is Jane Doe, with the lisinopril. The dose is 10 milligrams. The frequency is daily. The documentation is correct on the MAR and the medication label. The route is by mouth. Okay, and then next we have our next medication. So for patient Jane Doe, she has the medication acetaminophen, the dose of 650 milligrams, the frequency of every 6 hours as needed for pain, which she is experiencing a pain level of 3 right now. And the right documentation, so it is correct on the label and on the MAR. And the route is by mouth. Alright, and she will be taking this with a glass of water as well. So now that we've administered the medication, and I ensured that the high alert medication, which is insulin, was double checked, we will verify that the patient is not experiencing any difficulties with the medication, and I will dispose of my gloves. And alright, so I'm going to go ahead and do one last environment check and make sure that oxygen and suction is still functioning properly. I'm going to go ahead and return the bed to the lowest level, make sure the bed rails are still up, the bed brake's still functioning, and put the call light within arm's reach of the patient. I'm going to wash my hands for 20 seconds. Okay, let me know if you need anything else from me. I'll just use the call light. It's within arm's reach of you, and I'll be in right away, okay? All right, and